And Monday is the deadline for people to buy 2014 health insurance at healthcare.gov. A CBS News New York Times poll just out this morning shows many people still have doubts about the Affordable Care Act. Chief White House correspondent Major Garrett is with us here. Major, good morning.
Well, good morning, Charlie and Nora. The Obamacare website is performing better, but impressions of the law itself remain negative. Even among those Americans it was designed to help the most. That would be the uninsured.
Have a deep breath, please.
The new CBS News New York Times poll of Americans with and without health insurance found more than a third of the country, 34%, believe the law will hurt them personally. 16% said it will help them. 46% said it will have no effect. We interviewed more than 700 adults without insurance and found optimism mixed with negativity. Nearly 1 in 4 of the uninsured said the law would hurt them, even though they currently have no coverage at all. 1 in 3 said it would help. Looking to the future, the uninsured were equally divided on whether Obamacare will make the healthcare system overall better or worse. 1/3 said better, another third said worse, the remaining third said it would make no difference at all. Overall, 39% said the healthcare system will be worse, 36% said better, and 21% said nothing would change. We met Beverly Sina in Middletown, New Jersey, and found ambivalence bordering on pessimism. Sina and her husband are uninsured. After numerous frustrating failures on the bulky Obamacare website, Sina discovered the cheapest plan for a family of 3 would cost slightly more than $400 a month. Too much. Sina won't enroll.
I'd rather pay the fine and than spend a lot of money and have a health care plan that really isn't going to do much for me.
Sina is an independent voter who said she wants the law to work and blames Congress for its flaws. She hopes more families fare better than hers.
I really think that the new law that they have is going to help a little bit more than hurt.
Now, Sina would like a plan that covers only catastrophic health care costs, but she's too old to qualify. Her story is one of many, and tens of thousands are enrolling weekly in Obamacare before that December 23rd deadline to secure coverage beginning January 1st. Of course, the biggest hope at the Obama White House is that perceptions of the law improve, Charlie and Nora, as the uninsured become insured.
Major, while you're here, I want to ask you about these big tech executives that were at the White House yesterday. What went on? What were the conversations?
2 hours of the meeting, twice as long as scheduled. The president injected IT procurement at the federal level and the healthcare website into the conversation. The web executives, high-tech executives said, look, Mr. President, we're here to talk about NSA surveillance. Cisco is losing market share overseas. Other high-tech companies are losing market share because of concerns about NSA surveillance. IBM had a shareholders lawsuit filed because their shareholders believe their complicity with NSA surveillance is undermining the brand name. All those things are huge commercial concerns. The White House will announce next month some changes in NSA surveillance, and the high-tech companies wanted to make sure their opinions were strongly heard, and they were.
Thanks, Major.
You got it.